they was on it like white on rice. So it's helpful in that respect. When there was a change in your pharmacy, they took charge of facilitating that, which is helpful to me. In the busy world that we have and the number of patients that we have to have, this is now become an essential service, so that things that I don't really have to do, there are team members here in the care coordination team who can do it instead. Okay? Yes, they'll bring it to my attention and tweak my nose and keep me on my feet about doing it. So I think it helps both we as the physicians, nurse practitioners, physicians assistants, to be able to afford a better quality of service to a patient like Louis Roman and for the other patients that are in the room. But my experience obviously is with Mr. Roman, and I'm happy to have had it. And the care coordination team know I be down there all the time.
Yeah.
His name is Mario Donis, and when he was brought onto our panel, he was brought on because he needed help with like pre-op clearance and surgery, and he just couldn't figure out the steps to like how to get him there. So when they gave him to me, I did a home visit and I explained to him how care coordination worked and you know, the things that we would help him do as far as getting to reach his goal as far as surgery. I have connected him with all of his specialists, and I think that today would be a good day to graduate Mr. Donis because he has completed everything that I've asked him to do.
I'd like to say something. When I first got to this place, I was bothered in my mind, hurt. I didn't know what to do. She started talking to me. I kind of opened up my heart. She's been like my daughter. She's helped me a lot. I'm still in pain. I'm still going through medical issues. Fortunately for me, she's been there for me, and I'm hoping that the future will tell more on whether I can walk better and be able to have my stability in life because of these ladies, not only her, but this young lady right here.
So he was brought on the panel, and after doing research, I figured out that he hadn't seen a quite bit of his specialists in a very long time. So I connected Louis with endocrinology, cardiology, our very own Maria Colon, who is our diabetic counselor, and along with a few other people just to help him manage his diabetes and just control his utilizations overall. Throughout that, I realized that Louis needed more than just to be in the home. I felt like he needed to get out, and he wanted to get out. He wanted to do more and not just sit home because he was diabetic and because he had seizures. Even if it's Jessica dragging him along, she's been right there every step of the way. Not too many people have a good support system, and she is like everyone wrapped in one for him. And without her, I don't know how we would have gotten this far, but today I'm happy to say that we are graduating him because
I gotta thank everybody because I'm still here. So, not to listen to nobody, I wouldn't probably be here. I mean, I go to the hospital and listen to all the doctors. For what reason, the doctors are help me, and I would rather receive help than not receive no help. But I thank everybody, and I give a lot of blessings to everybody.
I really thought I was about to lose my brother. In 2 occasions, I found him in very bad condition, and she came just in time. I have my own medical issues, and She's always been there so much for my brother as for me, and she said like she's already part of the family. She's not just his homie, she's a friend. She's like a sister. She helps me with him because it's hard having to deal with my brother. But she helps me pull his ear once in a while, and when she has to, she's always there. Like, I really appreciate all the help you and the team have done for me, for my family. It's just good to know that there's people out there that are willing to help.
Because I was down, didn't have no one to talk to, and I was going through a lot of changes. When y'all picked me up, y'all lifted my spirit up, brought me up from where I was. Since I came on your all team, I have changed my whole attitude and everything began to look up for me. And without you all, ain't no telling where I might be today. You, Kelly, and all the rest of the young ladies. Had bad foot, bad heart, bad good eye, everything going on. Now that I've been with you all, things begin to look up. You have kept me on the right track, made sure that I go to my appointment, and I appreciate that. Like I said, without you, I don't know where I would be. You're my little bunny rabbit. You always will be my little bunny rabbit. They have put me in the right direction, and I hope they continue to put me in the right direction. My life is about 85% back to where I want it to be. I'm moving on in the right direction.
We started working together because I was admitted to the hospital.
No, I'll go try. No, I'll get back.
I was admitted to the hospital with a blood sugar of over 800. They told me that I should not have been awoke, but by the grace of God, I walked into Cooper's being my normal self. Just tired, trying to figure out why. Tired, sluggish, pain in my leg, but I was alive. Just feeling sleepy, just tired. So they set me up with a care coordinator, this young lady right here, who's been like a niece to me. She arranged my appointments for me. She was there with me at my appointments, and she just gave me the emotional support that I needed. We talked every day. She's more like a niece to me than she was a health coach. It was not like a working relationship. It was more like family. It was family.
What are the most important things that you remember from your health coach?
To do what I have to do whatever that doctors ask me to do. And this one pushing me. When you're on your own, you really don't have anybody there. So it's like having somebody there is the biggest thing in the world. Just have somebody there to help you through this, because you don't know what to expect. And somebody who knows what to expect, and then what the biggest connection to she and I was is her mother is also God-daddy. So she told me some of her experiences with her mom, because I don't know nothing. I didn't know anything about this. Completely. It changed so fast that just from January to April, I was on insulin. As of the middle of April, I think about April 20th, I came off of insulin.
How many grandchildren do you care for?
18.
But how many are living in your home now?
5.
5 grandchildren, who she loves dearly. And I think what has happened is she's taken care of those grandchildren so much that she wasn't focusing on her own self. And she had so many medical problems that she didn't have the time or energy to focus on herself. So the care coordination team was able to come in and help her learn how to take care of herself because she was taking care of her grandchildren so much. And now they helped her be able to focus on herself and learn how to take care of herself because she was focusing on her grandchildren so much. Together.
Well, I had to take care of how to read my medicine, how to put them all together in a little box for every day, for the 5 days, 7 days complete. Well, I remember she brought a big picture. It was a picture, isn't it? Put them in the wall so I can, when I go back and forth, watch the picture and see what I was supposed to do.
I did a bulletin for her explaining why she should go to the ER, like when she should go, when she shouldn't go, who she should call when she has a problem. Just don't go directly to the ER. So it was educating her on not to misutilize the ED.
She had to be taught when she was actively having an emergency and before it became an emergency to contact her cardiologist so it wouldn't get to a point where it was an emergency. And that is what the bulletin board that Maria created also touched on.
Yes, I do.
So we had a 14-month-old that we put into the program. He had 26 different medical problems, so he is extremely complex. And they took him on, they worked with the family, and I was saying, Paige, you have 2 patients. You have the parent and you have the child, because they have needs just as well as the child. So this mom, she really wanted to get the child a medical day. She wanted to, we tried to organize all his appointments, and he really was able to achieve that. And to me, it's very emotional because, they become your family. And for someone else to help take over him and love him as much as we loved him was just so wonderful. And I couldn't be more thankful.
We love the Care Coordination.